and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctor, where we're teaching you how to live a longer and healthier life. I'm Lorena Anderson, your life and energy coach, and this show is being presented by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. We're broadcasting live right now on 1470 AM and 95.3 FM. We're also filming live. If you had the opportunity and you can get on the internet, we're on wwnnradio.com, also amp2.tv, and we're also at allcountyhealthcare.com. So if you have 80 questions whatsoever, you can call into the station, 888-565-1470, and we would love to have any kind of questions for our doctors today. And I'd just like to put out a shout to All County Healthcare for sponsoring this show. We're here every Tuesday between the hours of 6 and 7, and we have the top professionals in their field here to help educate all of us about your healthcare needs and your medical issues, whatever they may be. So without any further ado, I would love to introduce you to our first doctor, Dr. David Brodner.
Yes.
It is a pleasure to have you. Thank you so much for coming.
Well, thanks for having me. I'm excited to be here.
Oh, great. Well, I know what kind of a busy schedule and everything that you have. So I really do appreciate it. And so does my audience that you've taken the time out to come and be with us. So please tell us your specialty.
My specialty, and I was going to have you say the word because no one likes saying it, but it's otolaryngology, which is a really
otolaryngology.
Yes, which is a fancy way of saying ears, nose, and throat. So yeah, you did a really good job with that.
I did. You're
just
a good
rolls
teacher.
Off the tongue. So I do ear, nose, and throat. I also specialize in sleep medicine. So I'm board certified in both. So sleep medicine. Taking care of all kinds of sleep disorders, but the most common being snoring, sleep apnea, insomnia, people who have difficulty sleeping. So,
oh, that's very interesting. And boy, I've got to tell you, that is a big problem. You are absolutely right.
Huge problem.
So give us a little insight. What made you decide to get into this particular field?
Well, I think the nice thing about the field is that I can branch out and do a lot of different things. So, for instance, like the sleep medicine component, that totally came 10 years after I started my practice. So,
okay, was it because you couldn't sleep?
No, I think, the work was putting me to sleep, so I needed something else to kind of spice it up. But, I got into sleep medicine when it was still brand new, and it's still evolving at a very rapid pace. But I think variety. I mean, we do a little bit of everything. We see, in a day, a person who can't sleep, a person who snores, a person with a sore throat, a dizzy person, someone with hearing loss, maybe somebody with a lump or a bump in their neck. So it's a variety. Well,
that must be really, really nice because it gives you that variety of issues and everything. Yep. But that also means that you've got quite a broad spectrum of education and knowledge.
It is a pretty broad specialty. So what I did was in 2009, I started my own office and started to subspecialize in sleep, sinus, and allergy. So even though I do see all ear, nose, and throat problems, we really focus on sleep, sinus, and allergy.
Gotcha. Well, please tell our audience how to get a hold of you.
Oh, sure. David Brodner. You can get us on the internet, brodnermd.com. Our phone number, we're out in West Boynton, Boynton Beach Boulevard, so 561-735-8750. Give us a call. We'd love to see you. We do special scheduling, so, it's such a pain, literally, when you're sick and your doctor can't see you for 3 or 5 weeks. So that's why urgent care centers are popping up all over.
Yes.
So we really pride ourselves on seeing you when you're sick. So same day, next day appointments are our specialty.
Oh my goodness, you're kidding.
Yeah, no, we have a special scheduling. I don't. I come on radio shows.
Oh, okay, there you go. Excellent. Wow, that is really exceptional.
Well, you gave a shout out. I'm going to have to give a shout out to what I call my dream team.
Yes,
my
please.
staff are fantastic. We couldn't run our VIP kind of practice, treating our patients so nicely without them. So,
wow.
Joanne, Emily, and Ramona.
Oh,
they'll be happy to see you when you come by. Say hi.
That is wonderful. Where are you located? I know you said you're in Boynton Beach. Where at exactly? What's your
we're on
address?
Boynton Beach Boulevard. So we're a little west of the Turnpike. It's called the Canyon Town Center Shops. There's a Publix, and they're building a Starbucks, so it should be quite popular.
I like that.
Yeah, Boynton Beach Boulevard and the Turnpike.
Okay, great. So I have interviewed many doctors, and they've always mentioned that there was something when they were younger that put them into the field that they were in. You know, whether it was like 6 years old and their grandfather was a doctor, or, 10 years old and their father was dealing with some health issues, and that kind of made them decide, well, I really want to be a doctor.
Sure.
What was it for you?
Well, my dad's a neurosurgeon. He's up in West Palm at Good Sam. Been there since the 80s, so that's probably it.
Okay.
Thanks,
Dad. A shout out to Dad, too. I love it. So let's talk a little bit more about the ears, nose, and throat.
Yeah.
And then we're going to have a discussion about the subspecialties that you were talking about, the sinuses, the allergies, sleep disorders, sleep apnea, those type of issues.
Sure.
Okay, so ears, nose, and throat, what do you mainly see? What are you dealing with on a
I
day-to-day
think for the
basis?
ears, our main thing, hearing loss and dizziness.
Oh, okay.
And then you get the, every so often ear infection, swimmer's ear in adults. The nose, lots of stuffy nose, lots of runny nose, lots of sinus headaches out there.
Really?
Definitely. The throat, that's mainly either a sore throat, drainage in the throat, that really bothers people, or voice problems. Their voice is hoarse. And, if you have anything for too long, a month, then you should really go and make sure that it's nothing routine. It is something routine. It's nothing to worry about. So if you've got a sore throat or hoarseness or ear pain for longer than a month, it's not getting any better, it's time to see the specialist. And we check you out and make sure there's nothing in there that we need to worry about and take care of.
Wonderful. Well, I know that I've got quite a few friends, and some of them have some very severe allergy problems.
Yes, allergies are huge
in
South
goodness.
Florida.
It really is, and you wouldn't think it. At least I wouldn't. Coming from the north, I wouldn't think that it would be that drastic. But I've got a couple of friends that have constant nasal drippage, and really to a difficult extent.
It does seem silly in a way. It's nasal drip, not a big deal, but it is a big deal. I mean, it is very annoying. It makes people feel self-conscious. They're coughing, clearing their throat. People don't want to be by them because they think they're sick, but really it's an allergy. So, I mean, South Florida, we have no winter, lots of mold, lots of outdoors activities. We're green year-round, so allergies are huge.
Wow.
We treat allergies very simply. We start you off with medication. Our philosophy is really only use medicine as needed. So we'll never have someone on medicine every day. And okay, see you later. The next level is we do allergy testing.
Okay.
We test for things in the air, like people would call hay fever. We do food allergy testing.
Do you? Wow.
And we take it to the next level. People who you might have heard of allergy shots.
Oh, yeah.
Those have been around for years. We're also one of the few places that do allergy drops. And allergy drops are the same idea as shots, but instead of a needle, a little skin prick, and you go to the office, it's a little sugar water that we put the allergen in. You drop it under your tongue, so no needles, and you can do it at home. You can do it anywhere, really. So we offer everything.
That's wonderful.
For allergies. And then if it's not allergies, if it's something else, say somebody has a chronic sinus issue, then we also are able to fix that.
That's very interesting. Tell us a little bit about the sinus issues, either all plugged up or sinus headaches, or what are some of the other things that they deal with?
First thing would be sinus headaches. So what is a sinus headache? Basically, a sinus headache is when you have pain or pressure over the sinus area, and it gets worse when the pressure changes. So a lot of people with weather, they say, I know when it's going to rain, or temperature. If they go in and out of air conditioning, it gives people who fly, divers. So anything like that, that's a sinus headache. And the nice thing about a sinus headache is we can fix it very easily. The bad thing about a sinus headache is a lot of people think everybody has sinus headaches and it's something that they need to live with. But really, the quality of life of someone who suffers from a sinus headache is very low, like even worse than people with asthma or medical problems that people think are serious. So we see a lot of sinus headaches, and we can fix them now in the office. And what I do is something called balloon sinuplasty. You may have heard of it. There's a lot of people on the radio ads, billboards, TV. It's all over the place. It's the new fad. Well, I've been doing balloon sinuplasty since it came out in 2010, and it's actually a tiny balloon. And what you do is you put the balloon in the sinus, and then you inflate the balloon. So that opens up the sinus. And then you take the balloon out. Balloon doesn't stay in there, but the sinus stays open.
It does stay open.
And now the air can go in and out, and the person doesn't have the pressure.
Very interesting.
And we can do it in the office.
I like that.
Yeah, so we do it in the office. We numb up the nose. Person's awake. In and out, 30 minutes. No pain, no bleeding.
And they're probably
it's easier than going to the dentist, yeah.
Oh, yeah, a whole lot
easier. We have some
easier.
people that it works immediately.
Wow.
So they're in the office and they say, oh, my God, I already feel better. And that's very rewarding. Usually I tell people, give it a month for the inflammation to go down, the swelling and the healing. But, that works very well.
That is really interesting. And the fact that the sinus stays open after the balloon comes out.
It's permanent. You don't leave the balloon in, and you don't have to do it again.
Wow. Oh, that's fabulous. So how does my audience get a hold of you again? Please give your address, telephone number, name.
BrodnerMD.com is probably the easiest.
Okay.
But phone number 561-735-8750. West Boynton Beach.
Excellent. And if you have any questions, please give him a call, or you can call
give us a call.
us. Yeah,
no crank calls.
You can call the station, the radio station, right now if you have any calls. 888-565-1470. Give us a buzz. We'd love to answer any questions, and especially if you're dealing with any kind of sinus issues, allergy issues, and then we're going to go into sleep apnea, sleep disorders as well.
It seems like everyone's got sleep issues.
Yeah. Yes.
This is another thing. Kind of like everyone thinks with a sinus headache, everybody suffers. Everyone who has allergies thinks, well, everybody sneezes and has a runny nose. No, they don't. That's not normal. Same thing with sleep. So
it's not normal.
Yeah, especially in our society, people are kind of sacrificing sleep for other things. Staying up later, waking up earlier, going to the gym, watching TV on their iPhone, iPad, the classic story.
Oh, yes.
So really, you should be trying to get 7 or 8 hours of sleep.
They just got finished. They came out with a study not long ago.
That's right,
saying
American Academy
at
of Sleep.
least 7 hours. Yeah, because a lot of people are saying, well, I only need 4, and then I'm feeling fine and no problems whatsoever. But now what they've proven is that the mind goes through an exhaustion if it doesn't have the 7 hours of sleep. You might wake up and feeling wonderful and able to, maneuver without any problems whatsoever, but your brain is tired.
Your brain is tired. They have shown. They have different tests of coordination, vigilance, all sorts of things go down after just a couple of nights of bad sleep.
Wow.
And I think the people who say, I don't need that sleep, I can do in 5 hours, they don't remember what it feels like to be rested. They think that's their normality. That's their normal status, right? But if they actually get good sleep, and some people try to catch up on vacation or maybe on the weekends, but it really doesn't work that way. I mean, it takes 3 or 4 good nights' sleep to catch up from sleep deprivation. And every time you don't sleep your 7 hours, it just builds up and up. You can think about it as credit card debt. We call it sleep debt.
Wow.
And every bad night's sleep, you're just adding to the credit card. You got to pay the credit card back to get your 7 hours.
That's very interesting because, for a long period of time, they say, well, you can never catch up on your sleep.
Right.
And now I'm hearing more and more evidence that it's absolutely essential for you to catch up on your sleep and that you can catch it up.
Yeah. I mean, sleep is so important now. they've brought it into big businesses, teaching employees because it makes them more productive, more efficient.
Absolutely.
Athletes, sports teams are rescheduling the way they do games as far as home and away and maybe going to the West Coast. I mean, sleep has become so recognized as an important factor, whereas really before it was kind of relegated to something that may be more of a luxury, and you can kind of toss it away and say, well, I've got more important things to do. Really, sleep is one of the most important things you need. So
that's so cool. I just want to do a little shout out here to All County Healthcare. Thank you so much for sponsoring this show. We've got some of the most amazing experts and specialists, yourself included, absolutely, that are coming up with more state-of-the-art information for us and what they're doing to ensure our quality of life. And as we all know, you have quality of life, you'll have quantity of life as well.
Absolutely.
So thank you, All County Healthcare, for providing and sponsoring this show for us. So let's talk a little bit more about the sleep apnea, because I am, again, as I had said before, one of my dear friends and clients, he suffered and continues to suffer very much with the allergies, but he also has the sleep apnea. So what are some of the state-of-the-art things that are coming up now for the sleep apnea? Because you said it's changing rapidly.
Yeah. Sleep apnea, for those who don't know, is when somebody's sleeping and they actually stop breathing. That's what apnea means. And you can think about it as the person's choking because their tissues in their throat are collapsing. And it would be like if you're trying to sleep and I keep waking you up, and you're not getting a good sleep. So you might be sleeping 8 hours, but really it's terrible quality.
Right.
And then every time a person wakes up, it kind of shocks their system. So it causes issues with their heart and a lot of medical problems, diabetes and heart attacks and strokes and all sorts of things you don't want.
Wow.
And usually the first sign that brings people in is because they're snoring. So how do we treat it? Well, there's a lot of different ways. Some people, it's as simple as weight loss, although losing weight is not simple.
No.
Sometimes we use a mask, a CPAP mask, that they wear when they're sleeping, and it's attached to a hose, and a machine blows air into the throat so it doesn't collapse. Some people I send to my sleep dentist colleagues. They can wear a plastic mouthpiece, an oral appliance.
Okay.
There are a variety of surgeries that I perform for sleep apnea, sometimes on the nose, sometimes on the throat.
Wow.
One of the latest technologies is what I call a pacemaker for the tongue. So there's a company that we put a pacemaker in the chest and run a little wire up through the neck to the nerve of the tongue. And when the person's asleep, it energizes or innervates the tongue so it doesn't fall back, and that treats their sleep apnea.
Okay.
And about every 3 to 6 months, they're coming up with a new mask. So unfortunately, a lot of people have been diagnosed, which is great, but they're kind of thrown this machine in a mask, say, go wear it, and not many people are too excited to wear a mask. And it might not fit properly, or without the proper guidance, they kind of throw it in the closet.
Yeah, they
and
don't
say,
use it.
I can't deal with it.
Exactly.
And so one of our specialties is taking people who can't tolerate CPAP and getting them to the point where they can tolerate it. So different machines, different masks, different tricks like humidification and pillows, and then also fixing their nose, because if they try to wear a mask and it's blowing air and their nose is blocked up, well, it's never going to work.
Right.
It's never going to work.
They're breathing through their mouth.
Right.
And then one of the things that I heard was that their mouth dries out.
Their mouth can dry out, or they wear a big mask, which is less comfortable.
Yeah.
So, traditionally, an ear, nose, and throat doctor would not also specialize in sleep. But it makes sense because sleep and the airway, as we call it, where you breathe, is so important. So a lot of times we'll do surgery on somebody to fix their nose, like a deviated septum or polyps or something of that nature. And not only does that help their nose and their sinuses, but then it allows them to wear the CPAP for the first time.
Wow.
Because we can use a really small mask at lower pressures. It's comfortable. So
that's cool.
Can fix the whole thing.
Now all they need to do is put a little mister in there as well,
Yeah.
so that it doesn't dry out their mouths or nose.
That's right. It does have a mister, a
It
humidifier.
does?
Yeah, and you can heat it up.
Okay,
So, see, there you
all right.
go. You're on the right track.
I love it. I love it because one of my dear friends says, as I was saying, he does not have one of the misters, so
Really?
it's really difficult for him to sleep. But I will let
can
him
imagine.
know.
Absolutely.
And I'll pass on your information to him as well.
I hope so. Be happy to see him.
Yes. So, what are some of your other passions? I can feel you're passionate about this subject,
Really?
and I love that. But what are some of your other passions that you also?
Well, I have kind of a different practice. I do run a full practice in the office and see patients and go to the operating room and do procedures in the office. But I have this other practice where I'm kind of on the other side of medicine. So I do a lot of consulting work. We talked about the balloon. So back in 2010, I was one of the first people to work with the balloon companies and help them develop the balloon and their protocols and teach other ENTs how to use the balloon. So I'm really passionate about working with new devices, medical devices. So there's now an absorbable implant that we can put inside of the nose here to help breathing, kind of like a Breathe Right strip, if you've seen those.
Yes.
But inside, and it's permanent. That's
I
called
like
the
that.
Latera. So we were running one of the clinical trials in our office. There's a sinus implant that has medicine in it. So over the course of time, weeks to months, the medicine is inside of your sinus, and it just kind of leaks out, so you don't have to use.
Okay,
so
I
that's
gotcha,
been
yeah.
helping sinus surgery.
So it's kind of like time released.
Time released, right? Medicine.
Okay.
So different devices like that. I'm working with a company now that we can fix runny nose without surgery. So you would be surprised, especially as the years pass and we get a little older, people have runny noses, especially when they eat. Very embarrassing, very troubling, and they hate it. And so...
Do you find that sometimes that's the food allergies that
it could be,
is
but
making
this is
that
not.
happen?
This is like as time goes by, the lining of the nose you can think of as getting leaky. It kind of leaks, and the plumbing starts leaking, and it gets kind of stimulated by the eating.
Okay.
So this technology uses cryotherapy, so cold therapy. Go in and you kind of freeze, not really freeze, but get it really cold, the nerve, and that makes it stop leaking, so no more runny nose. So I'm really passionate about all of that. I do a lot of legal work, so I help veterans
Do you?
at the VA.
Oh, wonderful.
And the way that we do that is, if a veteran has a problem that had to do with their military service, they can get service connected. And it can be very difficult to kind of navigate through that VA system, the big government. So we specialize in helping veterans get their service-connected disability payments. I actually travel for that, so I work with a company that will send me around the country. I go to Pensacola a lot, maybe once a month, and see veterans there, but then also in our office.
Wow.
And
Well,
the
good for you.
non-medical,
Thank you.
I've
That's
got
wonderful.
4 kids and 2 dogs, so that keeps me busy. And when I
imagine
have time,
so.
I play poker. I love playing poker.
Do
So.
you tell us about your poker?
Not much to tell.
Where do you play?
Palm Beach Kennel Club.
Okay.
Yeah, you know how people, they join fancy country clubs, and what club do you
Kennel
belong to?
club?
Yeah,
The dogs?
I say, I belong to a very fancy club, the Palm Beach Kennel Club. So maybe they'll
love
become a sponsor of the show now.
Oh, I love that. Yeah, that sounds wonderful. Do you show your dogs since you're at the kennel club?
No, they're just tiny little King Charles. So
They're adorable. Very
they do a
cute.
lot of lying around, not too much running.
I gotcha. So shout out to your team, please, because it seems
my
that
dream team.
Your dream team.
My dream team makes it all happen. I think we were talking, maybe we weren't even on air, but how we really have special scheduling because, people when they're sick, they want to be seen now.
Yes.
They don't want to wait 3 weeks. So we fit people in the same day or the next day. So they make that happen. We treat you like a VIP. We call everybody with their results. We don't make them wait with our scheduling. It's very uncommon for us to be more than 20 minutes behind.
Wow.
Your time is valuable, so we respect that.
That is absolutely wonderful. Yeah, I've got to tell you, it is so nice to have to have you here and to explain to us how you take care of people. Right. Because really, that's the bottom line. How doctors have really a warmth, a caring, a tenderness, a compassion for what you're going through. And they, as you heard, they don't want you to wait 2 to 3 weeks to be able to finally get in. I mean, unfortunately, for some, depending on what it is, that could be life or death for them.
It could be life or death. It's just also very frustrating. We've got people who are sick and want to get better, and then we've got people with chronic problems, and they've decided, okay, now I'm ready. They don't want to wait anymore. And so we take our time not only to evaluate them properly, but to explain everything. I mean, when you leave our office, you have a handful of papers where everything is explained. So we'll say it one time, Ramona will tell you on your way out, and then it'll be written down the third time. And then when you don't like that, you go back on the website and watch the videos. So we want people to understand what's going on. We're very thorough. We do a lot of testing. And also, like I said, we try to be on the cutting edge of using all of this new technology before it's even available to the general ENT, because we do a lot of clinical trials. So, you might be able to, if you're a proper candidate, be treated with the latest where you can't do that anywhere else.
Give
even
Dr.
in the
Brodner
country.
a call. Absolutely. If you're dealing with some of those issues, and it can be a case study for you, and please, by all means, give Doctor a call.
Yep, give us a call.
Yes. What's your number?
735-8750.
And that's a 561 area code.
561, yep. We're okay. Yes. You're good.
Well, sometimes you never know when somebody might be picking up on the show.
You're right. I forgot how far south I was. I'm in the 954 country.
Well, you're on the cusp.
On the cusp.
Well, thank you again. I so appreciate you coming and being a part of this.
Thank you very much for having me.
It has been
very enjoyable.
Absolutely enjoyable for us, all of us. And if you have any questions for Doctor and you weren't able to get his telephone number, you can always call All County Healthcare at 888-717-7170 and just ask for Maddie, and she can put you in direct contact with the doctor.
Absolutely.
Yes.
Absolutely.
So we're
come
going,
on by.
Yay, absolutely. Absolutely. I want to go,
Yeah, it's fun.
I'm sorry, I don't have any.
We have a great time.
Sinus issues or anything, but it's great. And I just want to let you know how much I appreciate the way that you take care of people. And I can tell that that's what your passion is the way that you care for people, the way you listen to them, and making them feel comfortable and validated in whatever it is that they're going through. So Thank you again. Well, we're going to go to commercial, and don't leave. We have another doctor coming right behind him. So stay tuned.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Oh, really?
Hi, hey, welcome back to You and Your Doctor, where we're teaching you how to live a longer and healthier life. You can find us on amp2.tv, filming live, and also on allcountyhealthcare.com. They are our sponsors tonight, and we are really thrilled that they have continued to sponsor this show. Our whole being here, the reason why we're here, is so that we can help educate you, give you the latest insights as to what's happening in the medical field, and also to be able to help you with any of the medical issues you might be dealing with. So we have another doctor on, as a matter of fact, and I'm very excited because I do know him from Florida Medical Center. He is the, let me introduce you here. Welcome. It's Dr. Vittimberga. Vittimberga?
Frank Vittimberga. Yeah. Pretty much like it's spelled. So yeah.
Okay. All righty. And he's with Florida Medical Center, and you happen to be the chief over there.
The chief medical officer. Yep.
The chief. So it's great to have you. Thank you so much, because I know it can be really, really busy over there at the hospital. So I really do appreciate you coming in and being a part of our show tonight.
Well, it's my pleasure, and it's a great opportunity, and we're really excited to get the information out.
Yes. I've got to tell you, it's a fabulous hospital. I've walked the halls many times over there, so I'm very familiar. So give us a little bit of background. I mean, what made you decide to get into the field of doctor anyhow?
Well, I kind of grew up with it in the family. My father is a surgeon, and my mother was a nurse, a psych nurse, for years and years, and so I was the middle child, and I was the only one who ended up going into medicine. So, I think I was the one who went so far around doing my own thing, I came back to what my father did. So it was actually, I kind of grew up with it, but didn't rush right into doing it. Finished college and did a year of research at Mass General before I decided to go to medical school.
So Mass General up in Massachusetts?
In Boston.
Boston, huh?
That's where I'm from, right outside Boston. And so I went to college in Cambridge there, and then
that's a beautiful college up there.
Yeah. No. So it was a great experience, and then although I'm getting not used to the cold weather anymore, but then I trained at the I went to medical school and did my residency at the University of Massachusetts in Worcester in general surgery.
Okay.
So I had a background in general surgery and went into practice outside of Boston for about 4 years, was doing a lot of trauma surgery and general surgery, and it was real busy, but then I joined a big group when I first started and had said, oh, this will be great. Everybody will be there to help me. And then pretty much I walked in the first day. They said, okay, here's your keys. You're on call. Figure it out.
Have fun. Don't call us. We'll call you.
So after about 4 years of that, I decided it was probably time to set out on my own. And so I moved to Dallas. And my wife was from Boston. And so she was very much like, people from Boston, they don't even consider really moving anywhere else. So when I finished training, she said, well, you can move wherever you want as long as it's within 20 minutes of where I grew up. And I'm like, okay.
Oh, my goodness.
So then after a few years, she was, a little bit more tolerant of maybe, and Massachusetts has its own style of medicine. So she was ready to try something else. And so she agreed, and we kind of said, well, maybe Dallas would be, a good place. We both wanted to be in a big city. My criteria was that they had to have a baseball team.
Oh, okay.
And so I went into private practice, solo practice in Dallas, and was there for almost 9 years. And over that time, I kind of had run the gamut in terms of medical staff offices. Really moved up through serving as chief of surgery and a number of other positions, and then decided I was going to go back to school and get my MBA along the way, and then was the chief medical officer there for about 3 years before I decided to move to Florida.
Oh, my goodness. So what made you decide to move to Florida?
Well, I think, it was really a combination of things that there was, we had, I was really very divided in terms of overall commitments, and doing surgery is a full-time job in and of itself. Mm-hmm. And so doing that, and then, with the commitments of being a chief medical officer was kind of a full-time job in and of itself too. So I think, really kind of finding a job that I could just focus on one area or the other.
Yes.
And my wife, she was really ready to move to
a warmer climate?
Yeah, well, Dallas is not too bad, but it still gets cold it's kind of the worst of both worlds. It gets cold in the winter and really hot in the summer. So she was ready for to try something different, and my boys, they race sailboats, and so we were traveling quite a bit, either to New England or to Florida, to Miami quite a bit. So we decided that it probably would be better to consider moving here.
I would say so. How old are your boys?
They are, one just graduated from college. He's 18, and I have another one that's a junior, going to be a junior, and 16.
Wow, he just graduated college at 18.
High school.
Oh, high school. Okay,
yeah, just graduated high school.
Wow,
no, he's going
really
off.
Good.
He's going off to college, hopefully soon.
Okay.
So
yes.
he's actually right now he's crewing on a tall ship in Maine, and then he is
beautiful.
going to Ireland to go to college.
Is he really?
Mm-hmm.
Wow.
To Dublin. So
I love Dublin. It's gorgeous.
So hopefully he will too.
Yeah. The pubs are really fun.
Yeah, well, I think he's enamored a little bit with that idea.
I'm sure he is. And what is he looking at going into? Is he looking at medicine as well?
No.
No?
Neither one of my boys. They're both interested in business. He applied to in Ireland. You apply to an actual program, and so he applied to the business program. So he's not very science inclined. He's already made his decision, and so I've got no doctors. I'm kind of
you're a lone ranger, but very, very well versed in your field. I am sure of it. Very well versed. So tell us a little bit. I mean, you're absolutely right. It's really difficult to be not only a general surgeon, but then also a chief officer as well. Yeah. And probably trying to, put that into some level of balance must have been really difficult.
It is. I mean, and ultimately, as you practice, you realize that if you're taking care of patients, their priorities have to come first, and they, really they supersede, really all your other responsibilities, both work-wise and, personal life-wise. And so, it gets to the point where you have a lack of balance, and really you have to just kind of realize that, you've got to prioritize things. If you're going to be on the clinical side, it really is a full-time job. So it got to the point where, I was kind of divided and decided that, really it was time to make a choice. And so I moved to a full-time administrative position. And so really it's been nice to have one job.
Yeah, I would think so.
And so really, so a chief medical officer, what we do is primarily function as a liaison between the medical staff, a lot of the medical staff leadership, the chief of staff, the chief of the different departments, and the upper administration, the C-suite administration in the hospital, and also are really primarily responsible for quality and safety, developing protocols that ensure that things run right, that mistakes are minimized, and that if things do go wrong, that we get to the bottom of kind of what caused problems and figure out how to mitigate it so it doesn't happen again.
Excellent. How long have you been there?
I've been there about 2 years and a few months.
Oh, okay. So. Okay. Now, did you come directly then from Dallas back over here?
I did.
Oh,
yeah.
Okay. Okay. Well, fabulous. Yeah. Fabulous. What are some of the other things that you have to that you oversee?
So the quality department,
yes.
The risk department. So a lot of anything, like, as I said, anything that goes amok in the hospital or any issues. Certainly I end up doing a lot of follow-up with families that have concerns or patients that have concerns regarding their care. And a lot of it, a lot of the issues that we deal with are communication issues. Really, primarily, there's a lot of issues in terms of people sometimes getting the messages of what exactly is going on with somebody's care translated, and the doctors are sometimes busy and they feel like they've kind of told you what's going on, and yet sometimes people are still confused, and so helping sorting through some of those issues.
Well, and we can understand that, because a lot of times, the spouse or the loved one, whomever is in the hospital with the individual, with the patient, they're pretty much traumatized. So, you could be sitting there saying, wow, I love that pink tie, and they're gone someplace else and not even understanding a word that you're saying. So, yeah, that's really invaluable, the service that you provide for that.
I think, again, and I think that there's not only just the that there have all these other things going on when people have health issues, but also there's, it's like going to the DMV, where you really have run the range in terms of educational levels and emotional levels, in terms of how people deal with things. And so it's really, you're dealing with a really broad cross-section of the population. And so it's learning how to interact with people and relate across a broad cross-section of people is
yes.
And that's one of the things that I think medical schools are starting to impress upon doctors now more, than, it used to be just do your anatomy, do your, pathology and not worry about it. But I think, we're getting a little bit more savvy in terms of how medical students are trained to really take into account some of the psychosocial issues that people have, and learning how to deal with them, as well as some of the business aspects that really we didn't really deal with when we went.
I love that. I love that. So, it sounds like it's becoming much broader spectrum of education for the doctors, so that they understand, the emotional intelligence piece of it, which is incredibly important, because, that's one of the things that is that they're dealing with is, the trauma of their medical issue, and then the mental capacity, their ability of being able to understand what's going on, and then the physical capacity as well. So that's fabulous to hear.
Yeah.
What are some of the other things that you end up dealing with over at Florida Medical Center?
Well, and I think, the other thing is transition of care, or where a patient's going to go once they leave the hospital is really important. And it sometimes, it's difficult. Patients have different social situations. Some of our patients have no real place to go. And so, whether we get them to rehabs or skilled nursing facilities or assisted living, or are able to get them home with assistance, really, it's helping to plan that whole continuum of care. And a lot of it goes off without a hitch, but oftentimes we get involved when there's more difficult issues, and particularly where we are in South Florida, we tend to get a lot of non-resident patients that are from the Caribbean and may not have the benefits of Medicare or social services, Social Security. So we've got to work kind of around those issues sometimes too.
Wow. Yeah, I would imagine that brings in a whole nother element, because sometimes it's just dealing with the Medicare, Medicaid issues, trying to, especially for our elderly, it can be really quite difficult for them to maneuver through all the various paperwork and what they need and how to, network it all together.
we Florida Medical Center is we've got a strong department, and really our social workers and Medicare department to help people to get through that paperwork, the Medicare and the Medicaid applications. And some patients, really their only option is to get Medicaid for long-term care, because what with typical private insurance, or with Medicare even, it's not really designed for long-term care of patients. And so if they're in the hospital and they have to go to someplace for custodial long-term care, there's really limited options to a lot of people, unless they have very specialized insurance that they select, well in advance for that.
Yes. Well, it's so important that you're there. Tell us a little bit more about Florida Medical Center and what what its offerings are? What makes it different? You know, I want to know why I want to come there.
Yeah.
You know, other than your big smile and everything, and knowing that you've got everything under control and taking care of business. But you know, at least from what I've noticed, being in the hospital, walking the halls, there's smiles that are going on. You know, there's a particular type of warmth, and it feels very homey.
Yeah.
But what would you, you're there all the time.
Well, I think, you know, again, I think that our goal is to create a welcoming environment, and really, you know, an environment where people want to come to our hospital. And, you know, we've always been known for our cardiac and cardiology programs, as well as our stroke program, or comprehensive stroke center. And we were the first open heart bypass in South Florida.
Really?
So, yeah.
Wow.
So many, you know, that takes us back many years ago since that we've been doing open heart surgery. But I think, you know, aside from that, it's really the kind of thing where we want to attract and bring people into our hospital to feel comfortable and create an environment where people do. And one of the great things about our hospital is that we really represent a broad spectrum, both with our employees and our patient base. And so, you know, it used to be kind of United Colors of Benetton ads, where they kind of had people from all different backgrounds. And that's really what we have, both with our employees and with the patients that come to us. We've got, you know, a very dynamic demographic, and it's really been, you know, exciting to kind of get to the point where people do want to come to visit us and you know, have procedures done.
Yes. So give us the address of Florida Medical Center.
So Florida Medical Center, I'm sure you've probably seen it. It's right on the Turnpike. It's right at Oakland Park and the Turnpike. Now it's at 5000 West Oakland Park Boulevard. The number's 954-635-7000.
Okay.
And that's the main number, and then you'll get an operator, and they'll be able to direct you as needed.
Excellent. What are some of the other things that they offer there as well?
Well, this week we just opened a new electrophysiology lab, and so an electrophysiology lab is a lab that specializes in looking at disorders of the rhythm of the heart. So, so people who have problems with chronic atrial fibrillation or irregular beating of the heart, or any issues of irregular beats. That's a lab where they can take people and both diagnose rhythm disorders as well as treat them by doing ablations. And these are pretty technical procedures that we do have quite a large number of advanced cardiologists that have special training in doing electrophysiology work and ablations.
Wow, that is wonderful. You know, and that's what I've noticed about FMC as well, is their level of expertise there. I mean, the doctors really, they know their specialty. They're incredibly good at it. And the other thing I have to say, too, is that their bedside manner. They're just warm. They're listening. They want to help. So there's a real compassion there that I find. Yeah. And I'm sure you do, too, as well.
I do. We've got actually a nice mix of doctors, of an older set of doctors who've been there since the hospital began back in the early 1970s, and so really have that experience and kind of a caring bedside manner. And also we've got a newer group of younger physicians who bring a breath of vitality to the area too. So yes. And then most recently, this year, we were recognized by the Human Rights Campaign as a leader in healthcare equality for our work with LGBTQ patients to try and attract patients. As I said, we try to attract patients from all different backgrounds, and so that's one of the areas that we want to reach out to our patient base in our area, and that's one of the demographics that really we thought we could help with. And
that's wonderful. That is really wonderful. Well, you're right. It has a great cross-section of diversity. And that's so important because that's what community is all about, is the cross-section of individuals. And in honoring each one of those individuals, no matter who they are, no matter, their lifestyle, their color, it doesn't matter. It's that compassion that I find is so relevant in FMC and so evident
Yeah, and I think, again, with all of healthcare, there are barriers to people getting treatment. And some of them are ones that we impose on ourselves, that we say, I don't want to go see the doctor. Or, the men sitting on the couch going, oh, this chest pain will go away after, I'll go in after Sports Center. But I mean, so there's ones that we just naturally, inherently don't want to go to the doctor. And then there's, financial ones with co-pays but there's also a lot of social barriers in terms of being able to feel comfortable with your doctor and feel like they understand your background and what your specific concerns are.
Yeah, and your culture and your belief system as well. And I think that FMC does an amazing job with being open to all the variety of individuals that you have coming in. That's wonderful.
Yeah, it really is. And, it really is, and it's reflected in the fact that we have such, a background of patients. And, really we do have a large Haitian Creole population and, as I said, a lot of island population. So really a great cross-section of patients. And it's really, over the last couple of years, we've had some new leadership and really gone in, a real positive direction where I think more and more people are being very satisfied with our hospital and actually seeking us out.
I love that. That's great. So you talked about the cardiac division being really, really strong and some of the state-of-the-art technology that you're bringing in. What else are you bringing into the hospital as well?
Well, in terms of on the cardiac surgery side of it, we actually do a lot of advanced cardiac surgery as well. So we've been fortunate to recruit a couple of very excellent cardiac surgeons that do a lot of advanced procedures in terms of rhythm disorder. So as I mentioned, the electrophysiologist can treat a lot of the disorders from the inside with catheters in the lab, but sometimes there's the need to do either a combined procedure where the cardiologist and the cardiac surgeon will work together to try and fix an issue, or sometimes it's something that the cardiac surgeon will, if they're going to do surgery for something else, they'll approach a rhythm disorder or atrial fibrillation, an abnormal beating of the heart with from a surgery perspective as well. And so we've been very fortunate to have those, advanced procedures. We're able to offer ECMO, which is extracorporeal membrane oxygenation, or basically a pump.
What is that, please?
It's basically a pump that can, if your lungs aren't working well, that we can pump the blood out of you, put it through an oxygenator that oxygenates the blood much like the lungs would do, and then pump it back into you. So it's able to support people for a longer period of time until their lungs can recover. Additionally,
That's
added,
very interesting. Wow.
And we've added the Impella device, which is a support device to help. There are actually little pumps that are catheters that go into the arteries to help pump blood if your heart's not pumping effectively enough.
That is incredible. So I love hearing about that. That is absolutely wonderful. And also the diversity and being able to understand various cultures and various individuals. So anything else that FMC is really great at? Other than the great big smiles and the warm feeling and having you there.
Well, we are fortunate, and again, as I mentioned, we have we're a comprehensive stroke center. Now, what a comprehensive stroke center means is that we offer the full array of treatments for somebody who comes in with a severe stroke. So there's a kind of your basic stroke center that would be able to, if somebody comes in and has evidence of a stroke, they would be able to give them a blood thinner, but basically would not be able to do some of the more advanced techniques and would have to transport the patient somewhere else. Oftentimes nowadays, EMS, if they suspect that the patient has a large occlusion in their brain with a blood clot, will go ahead and bypass the basic stroke centers and bring them to comprehensive centers, because we're able to offer the full range in terms of not only being able to give them the blood thinner, but also to offer interventions. We have neurointerventionists that are on call that can actually go in with catheters and pull out a blood clot out of the brain.
Oh my goodness!
So that, as we always talk about, when you have a clot in your brain, time is brain cells. And so the longer you go without getting blood to the brain, the more brain damage there is ultimately. And so we're fortunate that now we have a neurointerventionalist who's a specialized neurologist trained in this, that's based primarily at Florida Medical Center. So is there available to do these procedures on, a short notice.
That's really amazing. And you were talking about stroke. Give us some idea what an individual needs to look out or be aware of when it comes to stroke.
Yeah. So, I think part of it is that you have to be attuned to the fact that when something's not right, to suspecting a stroke. So typically people that have a stroke will start slurring their speech. You might notice facial droop or a drooping of the lip on one side, lack of movement on one side. Sometimes the first sign will be somebody will fall over because they had a stroke and they're not moving one side, and they'll fall to the floor. And again, the biggest thing is you don't have to be a doctor. You just have to, be there at the time and be aware.
Yeah.
And you just go ahead and call 911. And the quicker, as I mentioned, the quicker you can get a person to the hospital, and the quicker we can get interventions, the more likelihood that they're going to have a total recovery. And so, like I said, you just have to have a high index of suspicion. If you see something that doesn't look right, somebody's not acting right, don't wait.
Don't wait. So how did they get a hold of you again? FMC Florida Medical Center. They're located at
5000 West Oakland Park Boulevard, and that's in Fort Lauderdale. It's Lauderdale Lakes, and it's basically right out west on the Oakland Park till you get to the Turnpike.
Yep. And just before you get to the Turnpike, there's a little turnaround there, a little S curve. I've gotten caught there once or twice. Excellent. And what's the telephone number?
954-635-735-6000.
Okay, one more time.
954-735-6000.
Okay, great. If you have any questions whatsoever, just give them a call at Florida Medical Center. They would love to answer any questions that you might have. And in case you weren't able to write down that number, you can always give All County Healthcare a telephone call. Their number is 888-717-7170, and ask for Maddie, and she'll get the information to you as well. Well, thank you so very much. It is a pleasure to have you, and I'm thrilled that you came and explained about Florida Medical Center to us and took time out of your busy schedule. We really appreciate it.
Thank you very much. It was a pleasure.
Thank you so much. And you can, if you happen to be a doctor and would love to come on the show, please give us a call also, 888-717-7170. We'll see you next Tuesday between the hours of 6 and 7. Thanks so much for being with us. Have a good evening.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff,